Today. It is my pleasure to guide you through this evening's proceedings, and before we begin, we would like to play our safety briefing.
SWRHA Health and Safety Representative, thank you for your kind cooperation.
As we formally begin, I would like to invite you to stand for the national anthem. Thank you. Kindly remain standing as we now bless this evening's proceedings by inviting Patient Care Coordinator, Acting Valerie Williams.
Good evening, all. Can you please bow your heads with me as I pray? Dear Lord, thank you for every seat that has been filled here today. Thank you for each heart and each mind that fills the presence of this room. Our prayer today is that your will be done through this public board meeting. Take what we have prepared and multiply our efforts as only you can do. Stir our intentions and align them with your righteous will. Father, guide our hearts and minds from pride and selfishness. Keep love at the forefront of our minds today. Let love be the guiding light for all we set out to accomplish and celebrate. I bring before you the chairman of the board of directors and the other board members, the various managers of this illustrious organization, the Southwest Regional Health Authority, and all who will be participating in this event today. Guide and direct their hearts and thoughts, and bless them with your wisdom, your knowledge, and your understanding. Bless each head that is bowed before you now. And when this meeting would have come to an end, let us not forget to give you the praise, the honor, and the glory, is my prayer today in your name. Amen.
I'd like to acknowledge Mrs. Betty Ann Pilgrim, the National Administrator, Nurses Services, Ministry of Health, members of the Board of Directors of the Southwest Regional Health Authority, Mr. Steve Delas, Chairman of the North Central Regional Health Authority, Mr. Keith McDonald, Chief Executive Officer of the SWRHA, Mr. Ronald Sawyerfat, Chief Executive Officer, SWRHA, Ms. Satragi Maharaj, CEO of the Couva Regional Corporation, Alderman Hyacinth Rampasad Singh of the Penal DB Regional Corporation, Mr. Indy Stewart, President of the Trinidad and Tobago Registered Nurses Association, Ms. Ann Smith, President, Alzheimer's Association of Trinidad and Tobago, Ms. Sherry Ann Jones, Coordinator of the National Alcoholic and Drug Abuse Prevention Program, Alcohol and Drug Abuse Prevention Program, Mr. Kennedy Fleming, President of the San Fernando South Rotary Club, Mr. Nazim Hassan Ali, Presiding Officer, La Romaine Diabetic Support Group, management and staff of the Southwest Regional Health Authority, other partners in health, distinguished ladies and gentlemen, members of the media, good evening. It is indeed a privilege to extend a warm welcome to you on behalf of the Board of Directors, management and staff of the Southwest Regional Health Authority for the term 2017-18. We do have a full evening for you. The authority, in accordance of Clause 12, second schedule of the RHA Act, number 5 of 1994, is required to conduct a public board meeting at the start of each fiscal year. Let us acknowledge now the purpose of a board meeting. Whether private or public, it is to share progress, discuss issues respectfully, and develop strategies that enable the people and the organization to learn, grow, develop, and move forward together. As I look around, I am happy to see interested faces eager to learn what has been achieved in the fiscal 2018 and what are the plans for 2019 and beyond. What are our operational and clinical accomplishments and challenges that affect you? Today, you will hear presentations on the strategic, operational, and clinical aspects of the Southwest Regional Health Authority. Although you will be given an opportunity to ask questions, I will also like to highlight that in your packages before you, there are some comment cards where you can share your feedback and ask questions which would be collected during and after the public board meeting. It should also be noted that this forum aims at addressing issues and concerns from members of the public. I urge staff members to give priority to these members of the public, as internal issues can be addressed through the Customer Solutions Desk at the Human Resources Department at extension 4636, or the direct line 225-3962. So we are kindly asking the employees of the Southwest Regional Health Authority to please allow the public a chance to give their feedback and share their ideas to the board, and that is the sole purpose of this public board meeting. Also, if there is time constraints, feel free to fill out the comment cards and we will collect them, as I said before, during and after the question and answer segment. Without further delay, I would like to introduce the first presenter, Mrs. Valerie Allen Rollins, Chairman of the SWRHA.
No, it's still, yeah, I think it's okay. Thank you so much. Mrs. Betty Ann Pilgrim, National Administrator, Nursing Services, Ministry of Health. Mrs. Joan Yule Williams, former Minister in the Ministry of Community Development. Members of the Board of Directors of the Southwest Regional Health Authority. Mr. Steve Dillas, Chairman of the North Central Regional Health Authority. Mr. Keith MacDonald, CEO of SWRHA. Mr. Ronald Sawyerfat, Chief Executive Officer of the Eastern Regional Health Authority. Mr. Edie Stewart, President of the Trinidad and Tobago Registered Nurses Association. Ms. Ann Smith, President of the Alzheimer's Association of Trinidad and Tobago. Ms. Jerry-Ann Jones, Coordinator of the National Alcohol and Drug Abuse Prevention Program. Mr. Kennedy Fleming, President of the San Fernando South Rotary Club. Mr. Nizam Hassan Ali, Presiding Officer of the La Romaine Diabetic Support Group. Management and staff of the Southwest Regional Health Authority, members of the media, other partners in health, distinguished ladies and gentlemen. On behalf of the Board of Directors, I am pleased to welcome you all to the public board meeting of the Southwest Regional Health Authority to account for the year 2018. The Southwest Regional Health Authority comprises 750-bed San Fernando General Teaching Hospital, Area Hospital Point Fortin, Couva, Princestown, and Superior District Health Facilities, 2 extended care facilities at Couva and Point Fortin, 31 health centers, serving a population of approximately 600,000 people over a catchment area which stretches from Moruga in the southeast to Icacos in the southwest peninsula, and from Freeport in the north to Tabaquite in the east. These facilities have been are spread out over the wide geographic expanse of the South. And we have seen a number of patient visits in 2018 that was significantly different to 2017. It is noteworthy to mention that 5 emergency departments under our purview have had 262,648 patient visits in 2018. 262,648 patient visits in 2018, as compared with 153,797 the previous year, 2017, representing approximately an increase of 62%. I thank you for joining us this evening. Your presence signals your interest and commitment to collaborate in ensuring that we continue to serve you, the population, by improving the quality of healthcare in the Southwest region. As you are aware, the annual public board meeting is a mandatory requirement set out in the second schedule, Clause 12 of the Regional Health Authority Act, which states that the Regional Health Authority should hold an annual public meeting to review the authority's performance in the preceding year and its plans, goals, and targets for the current year. Today's forum and others of this nature serve to strengthen our commitment to the effective delivery of healthcare service by providing the opportunity for us to share information on our goals, achievements, and challenges, and just as important, get your feedback on what is working well or require improvement, in addition to answering questions on healthcare concerns in our region. Before I highlight some of our achievements for 2018, permit me to introduce the Board of Directors appointed in 2018 and 2019, and I will ask each person to stand as I call their name. So, yours truly is the Chairman, Valerie Allen Rollins. Ms. Giselle McFarlane is the Deputy Chairman. Dr. Shalini Puransing, Director. Mr. Anil Bagauti, Director. Ms. Jennifer Marisho, Director. Mr. Rene Gosain, Director. Dr. Sahid Rahman, Director. And not here with us this evening is Dr. Windsor Frederick, who was excused because of a death in his family. Mrs. Juliana Chang, who was appointed in 2019, so she's just with us for 1 week. So she's getting her feet wet at this time. Also sitting at the head table is the ex officio member of the Board of Directors, our Chief Executive Officer, Mr. Keith MacDonald, who assumed duties in August of 2018. The period under review saw the board working diligently, strengthening the governance framework to improve accountability and efficiency, providing strategic direction for the executive management team, and making resources available to successfully achieve the organization's mission through these financially challenging times. The board committees, that is, clinical governance, quality risk management, finance, human resources, audit, IT infrastructure and operations, tenders, and mental health and primary health care, commence our work by commissioning 7 quality audits and reviewing HR, legal, financial, and internal audit systems to assess the situation. These have led to the formulation of over 24 policies and protocols, and the development of corrective action plans, which are currently being implemented in service areas such as the emergency department, laboratory, pharmacy, nursing service, physiotherapy, nutrition and dietetics, obstetrics, neonatal and surgical services. In respect of the policy gap, extensive work has been done working through executive managers and their staff to develop the following policies: prevention and management of pressure ulcers, baby-friendly hospital, and that is working towards an international accreditation actually, and we are almost there in terms of meeting all criteria. Management of dangerous drugs, pharmacy pathway, block appointment, admission, discharge, and transfer. Somebody needs to move the slides on, please. No. Back up. The policies. The uniform policy on nursing personnel, occupation safety and health, updated medical records policy, and introduce an internal audit charter. Safe administration of drugs, nutrition and dietetics policy, a restraint and seclusion policy, ultrasound protocol, management of the nursing pool, consequence management policy, medical orientation handbook, workplace mental health policy, an audit committee charter, and rental of tools and equipment policy. Also, the orientation handbook for nursing personnel in primary and secondary care. 2 special projects were initiated to, 1, clear the backlog of laboratory reports so that the hundreds of patients awaiting results could receive them and appropriate treatment given. And 2, improve patient safety through implementation of a fall prevention program, which included the installation of grab bars in bathrooms and replacement of beds with non-functional side rails. In addition, the board, through its finance committee, cognizant of our economic constraints and the urgent need to improve efficiency, initiated the following. 1, expanded the internal PBX lines and introduced PIN numbers to monitor telephone usage, which have significantly reduced telephone expenses. Increased the complement of nursing staff and initiated action to comply with the industrial agreement as it relates to hours of work, thus reducing the need for overtime. Reviewed and introduced controls in many areas to address the abuse of overtime. Introduce more cost-effective meal combinations of equal nutritional value to some luxury food items, resulting in cost savings. And reduced medical equipment rental costs through the procurement of surgical equipment, resulting in cost savings. Ladies and gentlemen, the CEO and Director of Health will provide you with more details in their joint presentation on what has been delivered despite the many challenges. However, as a board, while we must ensure that high standards of corporate governance are maintained in the organization, this is being done in the context of our core business, which is the provision of patient-focused, compassionate healthcare and ensuring that we improve our standards of healthcare delivery. In order to achieve this, the board has mandated the CEO to ensure that the strategic plan of the region is aligned to the strategic priorities of the Ministry of Health and presented to the executive management, with 7 strategic goals that are aligned to the ministry's work plan to inform the development of SWRHA's strategic plan. The underlying theme of the strategic plan, sustainability through transformation, is timely since economic constraints are forcing us to become more innovative and creative in introducing systems of greater efficiency. The strategic goals enunciated by the board are as follows: to improve the patient/client experience and outcomes throughout SWRHA, to decrease clinical and corporate risks throughout the authority, to reduce the burden of preventable mortality before age 70 due to heart disease, diabetes mellitus, cancer, and stroke, to improve primary health care, including mental health, to improve health, safety, and the environment, which is HSE, and staff satisfaction, to reduce wastage and improve efficiency, and to adopt ICT as a critical success factor. The strategic intent is to enhance our clients' experiences and improve health outcomes through the strengthening of our primary, secondary, and tertiary and mental health, health and safety, and the environment systems, staff satisfaction, and information communication technology platforms, while improving our management efficiency and molding a motivated, customer-oriented staff to deliver compassionate care. Added to these, the plan will now include the operationalization of the new area hospital, Point Fortin. Improving our health infrastructure is one way of advancing health service delivery, as well as enhancing the quality of care that is provided within our facilities. The SWRHA is therefore pleased to add to our health landscape an additional hospital. The new modern digital Point Fortin Hospital carded for completion this year. The construction of this hospital will benefit the population in this area in a significant way, since patients from Point Fortin and its environs will no longer have to visit the San Fernando General Hospital for specialized care. This 110-bed facility will provide in- and outpatient services for both adults and children. This modern hospital will serve as a great complement to our faithful San Fernando General Hospital. Though it might be too early to feel the impact of all the work we have accomplished in 2018, you will soon be experiencing the benefit of all the work we have done, sometimes working 24/7 behind the scenes. As you can see, we have made some progress. However, there is still much more to be done. At the Southwest Regional Health Authority, we are all committed to improving the delivery of healthcare services with the goal of impacting positively and compassionately the people we serve. The SWRHA brand will depend on a cohesive team in moving forward. It is with this in mind, the board in 2019 is looking forward to the following priorities being addressed, since they are aligned to our strategic goals and will impact positively on both patients and staff. 1, full rollout of the CARE program, that is the Community Assessment Recovery Experience. 2, the establishment of the Health Promotion Unit and the introduction of adolescent health and men's health clinics. 3, to commence automation of health records to address the aged problem of misplaced files. 4, comprehensive review of the Department of Medicine and new arrangements to be introduced. 5, full implementation of the corrective action plan for the improvement of surgical services, including the surgical waiting list management system and the introduction of the pre-OP assessment clinic to reduce the number of surgery cancellations. 6, introduction of automation to the triage system at the emergency department and the bed management system to improve waiting time at the ED and admission. 7, introduce substantive measures to strengthen customer service, including restructuring of the call center to improve our response to the public. 8, completion of the remodeling and refurbishment of the labor ward and the neonatal ICU, and the establishment of the high-risk assessment unit. 9, remodeling of the Ward 5 to create a neurosurgical unit with the installation of appropriate technology. 10, completion of the daycare and homework center for staff children. 11, full automation of pharmacy, laboratory, and radiology services. 12, comprehensive review of the parking situation. 13, operationalization of the cardiac catheterization laboratory. 14, a reduction of corporate risks. The legal subcommittee of the Quality Improvement Risk Management Committee will be activated to mitigate the cost of litigation and raise awareness of the need for best practice to decrease the incidence of liability. 15, review and strengthening of the Corporate Communications Department. 16, strengthening of the preventive maintenance system. And 17, operationalization of the new area hospital, Point Fortin. A tall order, as you can see. Ladies and gentlemen, but we are equipped to do it. Soon after becoming chairman in 2018, I stressed that healthcare modernization and transformation with a cohesive team was necessary to improve the Southwest Regional Health Authority. As a board, with the unwavering support of the Honorable Minister of Health, we welcome the task of seeking to transform the authority into a state-of-the-art healthcare agency. We are committed to that goal, and we need your support. Today's public board meeting solidifies the importance of engaging with all of our stakeholders along this journey of transformation. This is important to us as we rely on feedback in order to strengthen the continuum of healthcare and increase public awareness on the issues affecting the local health sector. I wish to take this opportunity to thank all those who have contributed to the improvement of the services at the Southwest Regional Health Authority, especially our dedicated healthcare professionals, Chief Executive Officer and the executive team managers, supervisors, frontline staff, all allied staff, engineering, utility, security, sanitation, and all our support staff, as well as the chief executive officers of the other RHAs who from time to time have provided assistance for us, particularly in recent times when our CT scanners have been going down frequently and they have looked after our patients, and external providers to the SWRHA. While we do have more to accomplish, it is through your commitment that we have been able to achieve some significant milestones over the year 2018. To the directors of the board, you have given me, and by extension the SWRHA, your fullest support throughout the year, as we faced challenge after challenge with little or no positive coverage coming our way in the public domain. However, we give you, the public, the assurance that we will continue. So, what is this? Sorry. Just 1 minute. To exercise due diligence in carrying out our duties, in keeping with our instruments of appointments and the RHA Act. In closing, as chairman of the board, I again express our sincere thanks to you for your presence here this evening, and we look forward to your valuable contributions as we get to the question and answer period. I thank you for the courtesy of your attention.
Thank you, Madam Chair. Isn't that reassuring? Could we give Madam Chair another round of applause? Before I introduce the next speaker, I must say the goals highlighted by the Chair cements the Board of Directors' commitment as it relates to the development of the SWRHA and as it relates to development and the support of you, the people, and the patients. Just to reiterate a few key points, the Board of Directors' goals are to reduce the burden of preventative mortality, to improve the health, safety, and the environmental aspect of staff, to improve staff satisfaction, and to adopt ICT as a critical success factor. And I think that this indeed speaks to the Board of Directors' vision for the SWRHA and their commitment to you. Let me introduce our next speaker, Mr. Keith McDonald, the Chief Executive Officer, to the podium to make his presentation.
It's good to give in trouble. Okay. Thank you, Moderator Alison Riley. Mrs. Betty-Ann Pilgrim, National Administrator, Nurses Services, Ministry of Health. Mrs. Valerie Allen Rollins, Chairman of the Southwest Regional Health Authority. Other members of the Board of Directors of the Southwest Regional Health Authority. Mr. Steve DeLass, Chairman of the North Central Regional Health Authority. Mr. Ronald Sawyer-Fat, Chief Executive Officer, Eastern Regional Health Authority. Mrs. Saraji Maharaj, CEO of the Couva Regional Corporation. Alderman Hyacinth Rampasad Singh of the Penal Regional Debe Corporation. Mr. Edie Stewart, President of the Trinidad and Tobago Registered Nurses Association. Mrs. Ann Smith, President of the Alzheimer's Association of Trinidad and Tobago. Mrs. Cheryl-Ann Jones, Coordinator, National Alcoholic, Drug and Drug Abuse Preventative Program. Mr. Kennedy Fleming, President of the San Fernando South Rotary Club. Mr. Nizam Hassan Ali, Presiding Officer, Laramine Diabetic Support Group. Media personnel, other partners in health, distinguished ladies and gentlemen. It is my privilege to share with you, the members of the public and other stakeholders, the annual report of the Southwest Regional Health Authority for the fiscal year 2018. The authority's plans, goals, targets for the current fiscal year will also be shared with you and discussed. As you may already know, we are the largest of the 5 regional health authorities. We serve a clientele of in excess of 600,000 persons who reside in the geographical expanse that covers more than 1/3 of the land surface of Trinidad. The authority is responsible for the management of 818 inpatient beds throughout all our facilities. Our daily patient flow is in excess of 3,000 at all our facilities. These figures represent what we manage, and we strive to improve in our provision of quality healthcare to you. We know that there are gaps in what we seek to provide. We know that your expectations are high and we may not meet all of them. However, around the globe, there are challenges to all healthcare systems, and SWRHA is not immune. Our realities for the fiscal period involved an increase in patient demand for our services, aged infrastructure and equipment, and limited resources. Despite these challenges, we do not see it as an impossible task to achieve what we set out to do. I will now report on the non-clinical aspects of the Southwest Regional Health Authority. Our expenditure for 2017-2018 is $1.13 billion, of which 82% was personal emoluments. We would like to change our focus from spending as much as we do on secondary health care and shift that expenditure in the main to primary health care. And you would have heard our chairman express such sentiments. Our human resource overview. At the end of 2018, there were approximately 4,500 employees of the Southwest Regional Health Authority. By my research, it means that we are about the second largest employer in the country. 558 persons were recruited in the period, while a total of 2,867 received training interventions for the period. Some of these training that were delivered included customer experience training, customer development training, disaster preparedness and responsiveness, performance management and appraisals, diabetic management and insulin administration, stress management, our baby-friendly hospital initiative, prevention and management of pressure ulcers, amongst many more. During this period, we reconfigured our industrial relations unit. We have brought in a new industrial relations manager. We are currently conducting interviews for a senior human resource officer in the IR department. We are doing everything within our powers to ensure that staff satisfaction is at paramount. Our pension unit responded to queries from our retirees concerning pension and the implementation process, inclusive of such things like auditing, calculation of benefits by our actuaries, and payment of other benefits are paramount in terms of resolving our pension issues. We know that during the reporting period, we have not been able to deliver to many of our retirees, but by some of the facts that we have put in place and some of the things that we have implemented, we think that within the next 3 months, we should see a significant improvement in terms of our calculation and payment of pension to our retirees. Information, communication, and technology overview. Our Information and Technology Department continues to provide infrastructural works, networking, hardware and software, and application support to the Southwest Regional Health Authority. During fiscal 2018, the department expanded the use of our patient information system called SWRHA in the Accident and Emergency Department and at our outpatient clinics. ICT platforms have enabled the viewing of radiological images in trauma and the filter clinics of our emergency department. This has allowed doctors to see and access quicker patient information and thus reduce the length of stay for diagnosis and appropriate treatment. The Medical Records Department started the integration of medical records at the San Fernando General Hospital and the teaching hospital into one common filing system. The reorganization has improved the ease of and accuracy of records retrieval. Our archiving exercise continued with 20,000 records from the San Fernando General Hospital and the community being archived during the period 2018. We also commenced initial works to computerize over 20 million entries without records, within our records files. During this period, we acknowledged there were occurrences with our records, and the Southwest Regional Health Authority has instituted a process of assisting you in a real-time manner. This is what we are moving towards. And we believe that no patient should be left behind in terms of us not being able to produce your records. Security services. Our security services department examined and implemented a number of initiatives to improve accessibility to our facilities. The Southwest Regional Health Authority has experienced instances of pilferage by persons who are coming from outside of the authority during the night, etc., and would have been moving some of our equipment, stuff away from the facility. We have embarked on an exercise to secure our parameters to prevent loss to SWRHA's property and by extension the people of Trinidad and Tobago. The security services have started 2 new initiatives that serves as partial decentralization to some of our services. Normally, if one wanted to enter our facilities or the wards, they would have to get a pass and would have had to visit our security area, which is located on the southern side down at the Naparima Bowl. We have made it easier for you to access such pass at the quality department and not have to take that long walk to leave your ailing families or friends. So the other area is the increase in surveillance activities to ensure compliance and reduce pilferage. Facilities, administration, infrastructure, and operations overview. We have installed and commissioned equipment for use both in the primary and secondary care facilities. Equipment such as oxygen concentrators, neonatal ventilators, hemodialysis machines, orthopedic drills, and cardiac monitors. During 2018 fiscal year, we commenced refurbishment works to some of our wards and workspaces to increase our bed capacity, providing additional spaces for our services, improve safety, and standard of care. Southwest Regional Health Authority completed refurbishment work at the Penal Health Center, the Rochard Douglas Health Center, amongst others. As part of our drive to improve the aesthetics of our facility, we repainted several areas as well as within the general hospital, and roofs, gutterings, and other such areas were cleaned and installed. Electrical upgrades were carried out on 2 of our major buildings, the San Fernando General Hospital and at the health centers throughout the region. We have also acquired 3 new ambulances between the reporting period. I take this opportunity at this point to introduce Dr. Albert Prasad, our Director of Health, to report on the clinical aspect for fiscal 2017-2018. Dr. Prasad.
Good evening. Thank you very much, Mr. McDonald, Chief Executive Officer of the Southwest Regional Health Authority. All protocols observed. Let me begin by saying thank you for coming this evening. It's very important, and we look forward to events like this so that we can interface with you, because one of the tools to transform the Southwest Regional Health Authority is to know where we fall short and we do not meet your expectations. So that's the whole point this evening, that later on in the evening you will help guide us through our little difficulties that we meet from time to time. Who am I? I'm the Director of Health, and my function was well encapsulated in the first strategic goal, which was, and I'll remind you, to improve the client experience and outcomes throughout the Southwest Regional Health Authority. That's basically what I'm supposed to do. And therefore, I'm supposed to approximate international standards and meet your expectations. Of course, this is always an afternoon when we tend to showcase all our achievements. And so I will be brief and show you what our achievements are, and you will help me through the parts that we didn't achieve. So first of all, when we plan our health services, then there are obviously persons who have relatively simple problems, and there are those with complicated problems. So our health centers, the primary care centers, they are the health services which provide for us the things of the cough and the cold and the pain and the headache and so on, and a couple other services. And what we try to do is to ensure that we provide a service that the majority of people, we can meet their expectations. And roughly 90% of people are treated within our primary care services without having to be referred to a secondary care service. The secondary care service being our hospital services. Within the primary care services, we recognize that not only should it be a health center, but we have moved towards our health centers being wellness centers. And for that, we have brought about our health promotion approach to it. In other words, we feel that if we can advise people on how to remain healthy through lifestyle and exercise and so on, very many of persons who would have had to be treated within the hospitals can now avoid that. So what we have are our health promotion programs, which are represented in most of our health centers where advice is given. And in fact, within the past year, we've been able to increase our health promotion activity. We have found a number of persons in our employ among the professional groups that they are very interested and understand very well how to take the message out. So one of the big thrusts of the Southwest Health Authority is really to promote good health. And that is one of our main objectives, not only in the coming year, but for the years to come. Of course, there are those of us who unavoidably will become ill, and the health centers will provide the usual type of a treatment, so that you've got the services of being able to walk in and being attended to, and also to attend to specific types of illnesses. So we've got clinics that attend to asthma. We have clinics that will look at the chronic health illnesses like hypertension, that's high blood pressure, diabetes, asthma, etc. And that's ongoing, and what we have done is increase the numbers of staff who look after these types of illnesses. And what we have been doing is trying to move some of our hospital services into the primary care. There is the antenatal type of activity, which has been going on for years, but it has been increasing. And the latest move now is to put our specialist obstetricians into the health centers, so that very specialized treatment will be available, not only at the hospital level, but now at the primary care level. And the same will apply to diabetes, and we are now developing groups that will take diabetes to a higher level in the primary healthcare centers rather than having to come to our hospitals. Of course, the other services like pap smears, family planning, screening of eyes and so on continue to be available. And I want to say something about eyes. We instituted 2 or 3 years ago an eye screening program, particularly for persons with diabetes. And I am proud to say that as of the end of last year, we had looked at 11,000 eyes, screened them, and among those there were a few hundred of persons whom we detected would have lost their vision within a very short period of time, and the vision would have been a permanent loss. Of course, the non-communicable diseases run rampant in Trinidad and Tobago. And one of the tools that will stop that kind is the health promotion activity, so that we're hoping, and I'm of course quite confident, that in the years to come we will see a decrease in the number of persons with diabetes and high blood pressure in particular. And this really is one of the main objectives of the Ministry of Health. There is an aspect of primary health care that is of bother to us, and that is our young people. The present environment has now presented to us illnesses that hitherto were very scarce in the past, and that is the psychological and the psychiatric problems that we now see. I wouldn't say in an epidemic form, but certainly heading in that direction. And so this year, the Southwest region has dedicated mental health among the youth to that group of people, and we are fast developing child psychology and child psychiatry clinics. However, the limiting factor to that is in Trinidad and Tobago, we do not have enough personnel to deal with the numbers who we think are afflicted with mental health problems. But the Southwest region has undertaken to send 2 persons so far abroad to acquire knowledge in how to deal with these problems. So mental health is now on the front burner, where it was not before, but it certainly is getting there. And among the youth, the young again, we have the Baby Friendly Initiative, which, although it is hospital-based, is extended into the primary care, because we know it's no longer a secret that breastfeeding is the best approach to feeding our newborn. And under the guidance of our General Manager of Nursing, the Baby Friendly Hospital Initiative is being extended into the primary health care. One of our biggest successes, and it is not only the success of the Southwest region, but certainly of Trinidad and Tobago, is how we've been able to acquire longevity. And longevity is really due to diet, exercise, and immunization. And immunization really is one of our flagships. In the County of Victoria, we have achieved 100% of our objectives in terms of immunizing people. And County Victoria and County St. Patrick is not far behind, with 94% and 91% respectively. I have to thank all our nursing staff for that big effort. Thank you, GM Nursing. And our hospital services. We have just about every specialty that is represented in Trinidad and Tobago, except probably lung problems, but all the other services do have a presence in the Southwest Regional Health Authority. And for most of you who have families and friends who have visited the San Fernando Hospital will know very well what all those services are. But let me tell you what are the latest achievements. Yes, there is the word of overcrowding, and that's why I want to make friends with the media, that overcrowding is conquerable, and we are conquering it. One of the approaches we have used is the development of what is called the Clinical Decision Unit, known best in our hospital as the Observation Bay, in which we now have space, a ward that is dedicated to persons who visit our emergency department but do not need to be admitted to the hospital in the majority of cases. These persons have found themselves in a very comfortable area, Treatment is available almost immediately, and the tests can be conducted, and if we are able to make a decision within 24 hours, such persons need not be admitted. That's the advantage to those who visit. And the secondary advantage is that we don't need to use up all the bed space, so that we have been able to reduce waiting time. And thank you. And it is not until about a month ago, it was very unusual to have persons waiting more than 8 hours, where because we had come down from approximately 24 hours to 6 to 8 hours, and that was quite an achievement. So the clinical decision unit, which is a new unit, is now playing a great part. The other advances we have made is what is called the hemodialysis unit. Dialysis is a procedure that we do on persons whose kidneys no longer work, and therefore, as you know, your kidneys remove poisons from your body, and the dialysis does the job of the kidneys. They remove the poisons. Now, there are thousands of people in Trinidad who have to undergo that procedure. Our hemodialysis unit, up to about 14 months ago, were only able to dialyze 4 persons. Now, with thousands of people and 4 persons being dialyzed per day, you can imagine the type of waiting. We now have 14 beds. So again, we have moved our capacity to almost 400% in the last year. Our eye services, as I've said, we've saved hundreds of persons with their defective vision, but also at the beginning of last year, we undertook a cataract initiative in which we did close to 1,000 people with cataracts and almost wiped out the waiting time for cataracts. Of course, with our aging population, as we age, we will develop cataracts. So we have to be very vigilant in terms of the numbers of persons increasing year after year. And one of the big ones is obstetrics and gynecology. Again, I addressed the media there. We seem to be making the news so often in terms of persons who have complaints about obstetric services, and we are extremely sensitive to that. It is horrible for us as members of the Southwest region to lose anyone, and in particular to lose a mother. And therefore we have instituted ways to get around it, and on our labor ward we have placed doctors there on an ongoing basis. You no longer have to send for the doctor is there. In addition to that, we are reorganizing our labor wards, and by the end of this year, we will have 2 labor wards. We will have labor wards that are reserved for the midwives who do a fantastic job, and the majority of people who come to deliver their babies at us are all managed by our midwives. In fact, I made a call some time ago, Chairman, we should name it the midwifery unit. The second labor ward that will be available to us would where we anticipate there will be complications, and this is how we are going to get around persons who run into problems during their pregnancy. So that's another good thing. Not only that, but having put the specialists out in the antenatal clinics, what we have also done is develop a unit where mothers, expectant mothers who believe that their pregnancies may not be going altogether well, they can come in any day on our ward to be assessed in what we now call our day assessment unit. So we have really tried to get on top of this problem, and hopefully we do not lose another mother. and a baby in the process. It is one of our dearest concerns, let me tell you. And in addition to that, we have noticed that our neonatal intensive care unit, we need to redo the whole thing to meet modern standards, and that is about to start. In addition to that, our cancer services are growing exponentially. We now look after half of this country in an authority that did not have a cancer service at the very beginning. So we have taken half the load of the entire island. We are growing by leaps and bounds, and one of our biggest problems is space to accommodate our patients on a daily basis. But we have been able to supply them in 90%. I am assured by the general manager of pharmacy that we have supplied 90% of the medications to our persons with cancer. Why am I boasting about it? Because by the time we finish a course of treatment for our patients with cancer, we have spent nearly $500,000 on each patient. So we are very proud of that. Very lately, we acquired some equipment that will now allow us to crush stones in your kidneys and allow you to go home very fast. I love the name of the equipment. It's lithotripsy. It's a name you start seeing in the newspapers. But whereas before, some years before, persons whose stones we had to remove from their kidneys would require a big operation, so to speak. And those operations afterwards, you will be at home for quite a few weeks before returning to work. Now, come and have your stone crushed today, and I'll send you back to work tomorrow. And I want to thank Dr. Ramsubag, who was instrumental in ensuring that we got that equipment. In fact, I am assured by Dr. Ramsubag that he can do the whole island. Thank you. Our laboratory services have been slow to expand. We have new equipment and more will be coming in. So hopefully when we're here next year, we'll hear more about our laboratory services. One of the big advances, of course, is that we have been able to go back into primary care and do some of the basic tests, which we did not do for almost 2 years. Now we're able to do that. And pharmacy. We were lagging a little bit behind. We had an 8-hour outpatient service. Thank you, General Manager Pharmacy. We now have a 16-hour service in our emergency department. And finally, one of our services, which is unknown in the rest of the country. We have been looking at this, and we realize that teenagers are a different group of people from younger children, and they're a different group of people from our adults. So what we have developed is an adolescent clinic. And in that adolescent clinic, we now see young people with diabetes, whose diabetes require a different approach to treatment. We also recognize that there are teenagers who are worried about certain things and which were not addressed as a matter of course. You have young ladies whose periods are a bit early, young ladies whose periods are late, and they do contribute to types of illness in their later years. We have young men who have breast development during their teenage years. You can imagine the embarrassment. They are not going to go to Miaro and Maracas. And so that clinic is now, which started off with just a few people. Very soon, we are going to see over 100 teenagers in that clinic. And it's a clinic that we feel is going to grow, and it's going to grow into its own specialty. So I just wanted to alert you to what we have been looking to do to develop certain services in Trinidad and Tobago. And by next year, I hope we will be able to tell you more of the accomplishments in this regard. I thank you.
Very, very, very impressive presentation, Dr. Prasad. I thank you, and I thank Mr. McDonald. And I would just like to highlight from complete the presentation.
Thank you, moderator. One of the things that Dr. Prasad dealt with was urology. One of the problems that we have in Trinidad and Tobago amongst men is prostate cancer. We want to become the center that men with prostate will come to for one day surgery. And we have already made moves to order the equipment so that by the end of this year, we should see that service being implemented only at Southwest Regional Health Authority. Thank you, Dr. Prasad. There are many other clinical and non-clinical departments and units that were not highlighted this afternoon, but whose staff work tirelessly to deliver the service to you. It's with pleasure that I report that during fiscal 2018, we received close to 500 expressions of commendation from members of the public. And I wish personally to commend those staff members also at this point. Healthcare is often judged not only by the quality of care, but also by the compassion and dedication shown by those who provide the service. I'm proud to inform that in moving forward, our dedication to healthcare delivery will be reflected in our community assessment recovery experience called CARE, as was mentioned by the chairman in her deliverable. We will leave no stones unturned, and we will be taking healthcare to the public, to the community. It's our aim to visit every single home in the community, starting with our Pleasantville area and the Embarcadero area from April 1st. We will couple that initiative with what we call our specialized farmers market, where we will provide persons who suffer from hypertension, diabetics, etc., with a market where they can purchase those specialized products for your health, foodstuff that is, and also the diets that you will use during the week. So we are helping you to move the care to our next level. Trained personnel will visit your homes. They will be identifiable to you, and we will utilize every opportunity to ensure that we provide the service on a timely basis. We'll also be making some efforts to move our health promotion units, which will be pivotal in that development, implementing and evaluating community-based programs that will improve mental health, that will improve all the other aspects that we are seeing in the community that we too are very troubled about. All of these programs will be aimed at partnering with and empowering individuals and communities to promote healthier lifestyles. While these programs are geared towards prevention and early detection, the authority recognizes that for the last fiscal year, we have had over 400,000 patients visit primary care. As such, we will continue to build capacity at our health centers and to bring specialist physicians as well as experienced and expanded services directed towards our most common disease, namely diabetes and hypertension. The incorporation of wellness centers at 3 sites across the Southwest region, coupled with a number of diabetes special clinics, together with the implementation of the Global Hearts Initiative in conjunction with the Pan American Health Organization, is expected to reduce sickness and death from chronic disease conditions, both in the short and long term. One of the other programs that we are bringing on board is the Emergency Department Enhancement Project. We've already started the initiative. For those of you that have visited our emergency area, you will notice that there's a desk placed outside there. We are going to install a couple of televisions there for where we're going to put a number of videos and health promotion initiatives up on those screens so that you can view them as you come in. There'll also be what we call a reading area where we'll expose you to a number of literature that is aimed at, again, promoting healthcare. Our launch of our Customer Solutions Desk. We heard your cries of the last period, and we have implemented a Customer Solutions Desk where both staff and members of the public can call in and voice your concerns, your suggestions. And so far, we have had a 24-hour turnaround, a response time to persons who have called in at the desk. I want to commend Dr. Samaru and the members of the HR team for pushing that initiative and keeping it sustained. For the month of February, we received 28 such comments, of which 14 were resolved, and of those, 7 were commendations. Our cardiac catheterization lab, as you heard before, is due to commence. We have already initiated the process, and that will be something that we are aiming to provide in this coming year. The new Point 14 Hospital, I don't think I need to say any more on it. The chairman had covered that, but it's due for completion in October 2019. We will be embarking soon on a recruitment drive for the hospital. Healthcare is a right. It is not a privilege. At the Southwest Regional Health Authority, we have endorsed the philosophy that no one chooses to use our facility for no reason. Persons come to us for care, for help. We are here to partner with you to improve your health and well-being. We are here to help. I would like to take this opportunity to thank each and every one of you, our employees, members of the public, all stakeholders, for your contribution to the operations of our facilities at the Southwest Regional Health Authority. Thank you for your attention, and we look forward to your support in partnering with us to take healthcare to the next level. Thank you.
Thank you, Mr. McDonald. Serving 600,000 persons, plus serving half the country's cancer patients, paying particular attention to mental health issues, eye care, kidney care, operationalizing an adolescent clinic. These are the accomplishments of the SWRHA. And I think that they deserve a round of applause. This meeting is intended to be constructive and collaborated dialogue and information sharing. It should help interested members of the public to understand the role of the SWRHA. Before we jump in to our open forum, let me highlight some guidelines that are here to maximize the effectiveness of this event. Remember that SWRHA's directors and executives are here to discuss the achievements of the SWRHA for 2017 to 2018, Plans for the improvement of healthcare delivery in the Southwest region, details of the way forward for the SWRHA. For those persons who are employed at the authority, please note that all queries or concerns should be directed to the Customer Solutions Desk at the HR department, and you would receive a response within 24 to 48 hours. Please form a formal line at the microphone or indicate if you have a question or concern. Wait for the facilitator to acknowledge you. Additional matters can be submitted on a comments form located inside of your folder. They will be addressed by the appropriate personnel, and you would receive feedback. When speaking, please state your full name and the area in which you reside within the Southwest region. Please do not speak over another person. You will be given an opportunity to be heard. Please do not shout or raise your voice in anger or to get your point across. We are all here to listen and learn in the most polite manner. Please respect the agenda's timeline. We are under strict time constraints with the subject matters we have to cover. And remember, we are here to listen, record, and act. So let us start, and we can begin our open forum where we would take questions from the public. You are free to start the line, come up to the microphone, and remember that we are here as a team to help. Remember that this board meeting, although it is our mandate and responsibility to you to have this meeting, we did not have to go to the lengths of advertising it to get you here. Please be polite and address your concerns in the most respectful manner. Go ahead, sir. What's your name?
My name is Anthony, and it's a very rare name. SWORHIT from St. Madeleine. I do not have much of a concern, but I need to pay recommendation to those in authority because serving 600,000 people is a monumental task. And I am hearing about primary and secondary health care. And I think that the secondary health care, primary rather, is underutilized and should be more utilized. And you can have, this is my suggestion, added personnel with added time and to commensurate with proper payment. Don't forget that, proper payment. If you have these personnel working extra hours.
Thank you, Mr. Anthony.
And further, I would like to say that I am hearing that the Point 14 hospital, I am hearing about completion, but I am not hearing about operationalization. Thank you.
Thank you for your question and comment.
Good afternoon. Head table on everybody else, all protocols observed. I am Phyllis Brooks, live in San Fernando. First, I want to congratulate the board and the Southwest region because when I listened to the reports this afternoon, to me, a lot has been done. I do not know if I missed the part that they spoke about finance. I don't know whether they got enough finance to do all what they did. I don't know if I missed that. But I think we have to congratulate them for what they had done. A lot of things have been done. That's my first point. So I want to give the board a round of applause, please. My first question is, due to the influx of so many patients to Southwest Regional Health Authority, wherever they are coming from, whether they are outsiders coming, because of Petrotrin closing down, they have to come, and coming from many places. I want to know how they are treating with all the people who are coming, the human resource, if you have enough human resource, and if you have enough medical and surgical resource to fit all the people who are coming to the Southwest Regional Health Authority. And I heard Dr. Prasad said, how are we going to conquer overcrowding? And we know we have a problem with overcrowding. I want to know how are we going to conquer that. That's my first point.
Thank you. And we would allow Madam Chair to direct the response to that question.
Difficulty. But let me tell you some of the areas that we're going to cover. In the new teaching hospital, the medical chief of staff and I have gone through the entire building and have looked for additional space to accommodate patients. That's one. Two, the Point Fortin Hospital will help us through this also. We have a capacity down there of 100 and ordinary. Right, yeah. That will also help us through that. The clinical decision unit, as we have it at the moment, is being helpful in this regard. And fourthly, services are coming into play. For example, let me give you, at the moment we have 37 people on the wards who require, and I'm going to get very technical here, who need fistula to be done on them, 37. So there are discussions going on as to whether we can start a program on a Saturday to start to attend to those people with renal problems prior to dialysis. So those are some of the areas that we're going to address in terms of reducing it. So the reduction in using up our inpatient services, because we now have services that can accommodate people on a daily basis, looking for additional space. The area hospital, Point Fortin, as I say, is going to prove to be quite a boon for us. And we also there's also a place at the Point Fortin Hospital to do day surgery, same-day surgery. Now, if we can move all our same-day surgery people down to Point Fortin, we will be able to free up the theaters at San Fernando Hospital so we can accommodate more persons for more complicated surgery. That's where we're starting.
And as you talk about...
I just want to add to what Dr. Prasad has said, because he is focused on all the reorganization of the services in the secondary care institution as a way of dealing with the overcrowding. And I want us to start the mindset shift to taking people in primary care. We need to revisit the hours, yes, that we offer services out there, but more importantly, to start a consciousness dialogue about keeping people out of hospitals and starting the wellness clinics and stuff. That's a starting point.
Yes.
But also, recently, some of our medical and nursing personnel started dialogue in the community services, teaching people how and when you use a hospital so that people understand the whole issue of management of self. So we need to start that mindset shift, and we will have fewer people coming into the hospital.
Thank you very much. My next point is, have you received any equipment or drugs from the Augustus Long Hospital? Because I saw something on the paper saying that we might get those, and they're going to have a discussion concerning it. Have you received anything since the closure of that hospital?
Thank you, Phyllis, for your question.
Yeah, we are pleased to advise that as of yesterday, we started receiving pharmaceuticals from Clifton.
Ms. Phyllis, I thank you for your questions, and I encourage you to utilize the comment card.
Can I ask just one more,
as
please?
we have other persons waiting
Yes,
in line. We really want to push things forward and allow everyone to have an opportunity to ask their questions. But we value your feedback thus far.
Okay.
And I encourage you to fill out the comment card.
All right, thank you
so that we can treat with your other issues and concerns.
Thank you very much.
You're welcome.
The board of the SWRHA. Everyone, my question
What is your name, sir?
My name is Andy Scott from San Fernando. Apologize. My question is mainly for Dr. Prasad, the Director of Health. I am a patient, or was a patient at San Fernando Hospital in the emergency department. I came there after the floods back in November. I had done some work on some farms and so on in Sangre Grande, and I went through some floodwaters, assisting people, and I got sick, really sick, where we believed, and medical professionals at the San Fernando General Hospital said it appears to be the symptoms of leptospirosis. I arrived at the hospital at 8 a.m. This will be the 27th of November, you could check that. And I spent the entire day sitting on a chair, and I collapsed. And the very helpful doctor, a young lady, arranged for me to get a bed. They put me on the bed. They did whatever they did. They put me on drips. I was okay. They moved me to this new thing Dr. Prasad spoke about, this new area, the observation bay, where I felt a little better. And then they told me I had to leave and go and sit on a chair because I was not sick enough to use the bed. Okay, so I went on that chair. Yes, now I won't be long again. And where a doctor interviewed me again and told me realistically there is no bed, and I would have to wait till the next day to see if someone gets discharged to get a bed. That was after 11 in the night, after I've been there whole day very sick. Now, this is really about the overcrowding. The chairman said that you all had a 61 or 62% increase in people, in visitors at the emergency department. My question is, does the government, does the Minister of Health have this information? And what are they willing to do? And is this observation bay really working? And isn't the Couva Hospital, which is already built, wouldn't that help a lot with space as they are searching the entire hospital for space?
Thank you, Mr. Scott, for sharing your experience. And I must sympathize with you. I'm very sorry that you had to experience that. And Dr. Prasad would have said earlier that they are working vigorously to achieve 100% capacity of the intake of the patients that come into the hospital. But as in any organization and in any household, as we try to build and work towards progress, we will experience challenges, and I'm very sorry that you had to be a casualty of those challenges. Dr. Prasad, would you like to address Mr. Scott?
Thank you. Okay, thanks again for your observation. What you've just said has been echoed by quite a number of patients, and there are times when what we would call a surge in the number of patients that we see from time to time. The patients don't come evenly throughout the day. And I do apologize on behalf of the Southwest region that you had that experience. But as I mentioned earlier on, we are making every effort to try to eliminate that kind of waiting time. So you can always speak with me tomorrow. I'll pass on my phone number for you afterwards, and we can have a further chat on this.
Okay, thank you.
And just to add to Dr. Prasad, sorry, this booklet that each of you would have in your possession speaks to accountability. So what is expressed here today, it would not go on deaf ears. The Southwest Regional Health Authority is working to meet all of the needs of its patients and the citizens of Trinidad and Tobago, particularly those residing in the San Fernando district. Next question, please.
Yes. Good evening, everyone, and special regards to the head table. I am Shirley SWRHA, and I'm here in my capacity as legal guardian to a niece with Down syndrome, a special needs person. She had an emergency admission last year and received absolutely excellent care from Dr. Beam and his team, and I want to say thank you to that team. And I also want to thank the accident and emergency staff for the way they handled her. She's not regularly in hospital, thank goodness, and they were extraordinarily compassionate and patient and kind. I also want to thank you, Dr. Prasad. I don't think you would remember. I came to your office seeking some senior intervention for a procedure that she needed urgently, and this was addressed within 24 hours. In your very busy day, you may not have recalled, but I will not forget. So thank you. I want to also thank very specially doctors, I think it's Ramcharan and Furlong of her cardiac team. She's in the surgical clinic and the cardiac clinic, and each time she visits, they too treat her with the utmost respect. You would not tell from the consultation that she is a special need person with challenges. But my main purpose in standing here is to raise the issue of how special needs persons struggle. They have major challenges in accessing health care. And I am deeply saddened that when I listen to the strategic plans, I don't hear or see anything on your presentation that is specifically addressed to special needs persons. I hear about diabetes and I hear about mental health, and perhaps it is considered under the mental health umbrella. And the reason I say this is because although her medical care was excellent, and I sadly cannot say the same for her nursing care, and there is a major problem here with a policy regarding visitors. As her legal guardian and main carer, it was necessary for me to be with her throughout her stay because, one, she has never been away from us. Two, it's a traumatizing situation for her. And thirdly, and perhaps most importantly, she is legally incompetent to consent to treatment. And so when I was asked on the second night of her admission to vacate the ward because it is not policy to keep a visitor on the ward, I was astounded. And despite my pleas to the nurse in charge that this was not possible, I could not leave her. This fell on deaf ears. I then went to nursing administration that was on duty downstairs and did not get much help either. And the next Sunday morning, we were back to the same situation where the morning nurse was asking me to leave the ward, was telling me quite bluntly I could not stay with her. And I then said, well, I'm sorry, but I have to take her with me and sit in the corridor. And I was being told I could not take her either. And so we have a major issue here with the absence of a policy. I went down to the medical records department on level 3 to inquire about a policy on special needs patient and was told there was none and that one has to follow the national health guidelines. So it is deeply disturbing when you have a special needs person who needs the health care and the services are there, they're available, but she's unable to access them because a member of staff decides you have to vacate your role and your responsibility as a legal guardian to this person and wait in the corridor or even wait outside. So I would like the board to address this problem, and if a policy does not exist, whatever you can do within your committee structures to establish a committee exclusively for special needs persons and the challenges they face in accessing Southwest Health Authority services. Thank you.
Thank you, Ms. SWRHA, and I must say that is a very valuable comment and recommendation.
Excellent recommendation. It is a policy gap that will have to be addressed. And I can assure you that by the the time we report in 2020, there will be a policy in place on that.
I thank you, and I look forward to seeing it.
Excuse me, can you leave your contact information with us? Right.
Oh, thank you.
Yes, your contact information, because in formulating a policy, it's always good to consult with the people who actually have the challenge as you script the policy to address the issue.
That would be a
okay, right. Good.
Next question, please.
Good evening to the Board of Directors, members of the public. My name is Gregory Subero. I live in Pleasantville, and I work at Tabakit. I would like to first compliment the SWRHA for the great job it has been doing with limited resources. The doctors and nurses and other staff are to be especially commended. I must especially cite those at the eye clinic. They work under very distressing situation there, and they do a fantastic job. My experiences at the San Fernando General Hospital, the teaching hospital, the Princeton, Tabakit, and Pleasantville Health Center has been pleasant and very good. And I must say the nurses always get a bashing, but I may be lucky, but I always get good treatment from the nurses at these institutions. Now, recently, my 89-year-old father became unresponsive at home. We called the ambulance, and they came and they brought him to San Fernando. But while we were there, he needed to have a CT scan done. Both CT scanners were done, and they said it was too dangerous for him to go quite to Mount Hope to do a CT scan. So almost close to midnight, we had to find a nursing home to do a CT scan for him at a cost of $4,500 plus. My question is, who can I go to get a refund for that amount of money? Secondly, parking. I know it's been addressed, but it's not been addressed fast enough. When I get my back pains, I'm in serious pain, and to park at the bottom by the wharf there, and to hobble up, to crawl up to Casualty, it is not very nice. I live alone, and if something happens, I have to get there by myself. Thank you.
Thank you, Mr. Gregory.
In terms of the CT scan, we did experience some problems with our CT scanners. They were down, but I'm pleased to inform you that they are back up. Our 16 slides are back up running, and we are actively scanning patients at this point. In terms of the refund, I will just stop there. Parking. We do our best to ensure that as far as possible we can provide parking for both staff and the public. It is impossible for us to provide parking for everyone, but we are eagerly and vigorously seeking all the options that we have to provide as far as possible additional parking. And we are looking at some initiative now that should see that situation be resolved.
All particular served, my name is Albert Lawrence Joseph. I am from the Bay area. I am a patient presently at Southwest Regional Health Authority from the 5th of November last year to present. Really and truly, because of past experiences, I didn't want to go to Southwest Regional Health Authority. I'm being honest. I was stood back from Southwest when I discovered I was going blind. And I had to source outside private to deal with my situation. There's a serious problem with machineries, equipment. And if it's not a strong person to tell a doctor you're not doing certain things, they'll operate on you wrongfully. I had that experience. Where they wanted to operate on me, saying I had a child in my tube. And I stand on the ground, so I'm not doing it. And it's because my mother couldn't sign, they didn't do it. I had to leave and go private again. There to discover I don't have a child in my tooth, so I was going to be operated on wrongfully. They didn't have the equipment to see what was my situation. We talk about diabetes. Because of my experiences, I didn't go to the hospital, and which was the better thing for me to do. I saw my situation private again. When I take in sick, on the 5th of November, it was so bad, I couldn't walk, talk, do nothing. And it's because my husband and I say, but I kind of back private, I agree. Then you swing at the health center. I can't do nothing, so I had to stay. When they see my condition, they say I have to go right now to the hospital. I had to stay in casualty for a whole day, almost lunchtime on the 6th. And some of the doctors are nice, and you're in a position where you know that they life on that because I don't start to my face twist, pale, and then because you're a doctor, you come and tell me, I can't do nothing for you, you have to cut off your foot. And I'm like, with the attitude. So you're telling me a person who always walking and thing, and you just come and tell me, I can't do nothing for you, you have to cut off your foot, and I am telling you not to do this. And there was a battle. And it's so bad to the poison, don't take in my body already, and it's going on. There was not even one social worker came to talk to me. I had to source outside help to help me. Luckily, my sister is a social worker. She had to leave Tunapuna to come down to help me. When they got a letter, you're not seeing anybody. You just get a letter, to get a card, to come back 2-3 months after.
Thank you,
Miss.
Miss.
It is really real out there. When they get a doctor appointment, I had to do therapy, and I had cut off my foot in November. I didn't see a therapist until February. The area that we have to do therapy, and there are real senior citizens out there, is in our corridor. As a wheelchair person, I have to go through extra department to get to the physical therapy in a hallway where there are metal cupboards in the hallway. So if there's no assistance while I'm doing my therapy, and I fall and falling on metal cupboards. People walking in and out, and you trying to do therapy in that hallway.
Mrs. Joseph, I must sympathize with you.
I must say that I did have good doctors.
Yes.
They were helpful. But yes, sometimes I can understand why people will cause some carrion and get one because there are diagnosis out there that's really cool. I listened to just a question a patient asked about why it is I have let's say number 10 and number 40 and 50 is going before me. And that nurse ridiculed that man, and luckily he is big enough not to answer her. It is real out there, and you as board members, if you go and take the journey we as public do, from casualty and have to go through the steps and the pains and the trials and the tribulation, you'll understand why it is that we get on sometimes in the way that we do, right? But I must say that not because of my situation, but I don't want what I go through somebody to go through. And when you're discussing diabetes, you need to explain to people and show them the real hardcore consequences of not knowing what it is about and not grasping and understanding and doing what we have to do. Because if I had done that, and if I have gone through the health system where we need to forget the attitudes of the doctors and the nurses and go, because the services is there and there are good doctors and nurses to help us. And yes, we are trials and tribulations.
Mrs. Joseph.
I must thank the CEO for listening to me when I was crying my plight.
Mrs. Joseph, we really appreciate your comment and your sharing your experience.
In closing, I would just like to thank the opportunity to come here and my plight so that people will go through what I am going through. And for you also really educate, especially from even the preschoolers, about the consequences and what could happen. Because when they lose their foot, it's like everything. There are sometimes I will feel like I still have my foot. Right? And you know, these are the things that they didn't explain to me what will happen. You're feeling this to your foot and you have to go online and research it for yourself. So you all need to be able going into depth to people and really explaining what could happen before and after.
Very, very valuable.
And thanks again to the CEO for his assistance, because as I sympathize with the lady, being now in my position, it's really challenging. And even to get to clinic in the hospital is a challenge. Because today I was like...
Very valuable comments and experience. And
okay, yes, first of all, again, let me sympathize with your situation. I will try to address, first of all, the physiotherapy unit. We are doing some restructuring there to improve that facility. That should be completed in the too distant future. I would have visited you, right, and we'll have some discussions. I discussed your situation with our medical team, and you are on the top of our priority list for the home care visits. That is coming to you soon. It would have been what, how long? About 3 weeks ago I visited you at your home.
Yes.
We had a discussion about these things. I know that we made a pair of crutches available to you. And is that working? Do you have it still?
Yes, it's working.
So yes, we have not forgotten you. And we will be visiting your home outside of the care initiative as part of that, and provide you with the necessary help that you require. Okay?
Thank you. And then just a quick note. We all also need to pay attention. So when people leave the hospital, they leave with no equipment. I left in November. I didn't get my crutches until February.
thank you, Mrs. Joseph. And I can assure you that the CEO and his team would make every effort to address all of the concerns to help you through this time. Next question, please.
And I'm from the Marabella area. This is actually my first experience with the Southwest Regional Health Authority. I actually came from the system of Petrotrin. I had a scenario about a little over a month ago with my 17-year-old son. For a child who has been very active, no sort of complications or health issues. And then within a matter of a week before he actually came to the emergency and accident, he fell ill. We suspected it probably could have been just a simple case of the flu. But we continued to maintain contact with his private practitioner at Petrotrin. And we took him privately to get his test done, checked to see if he has chikungunya, H1N1. And then all the tests came back negative. So we suspected, okay, it's probably just a rare case of one of the viruses just taking his body a little much. And then within a matter of, I think, overnight, on Friday, the 7th of February, we had to call the ambulance for my child because he developed a seizure. That was most frightening. And immediately, he was taken to the emergency and accident, and there was a team of wonderful doctors ready for this child. And as I said, this is the first experience for me. So when you have your one and only child sick to a point where he can't walk, he can't talk or anything, and you see a seizure in real life, it's very frightening. And Dr. Narayan Singh, sir, he's not here, but Dr. Narayan Singh was heading the panel at emergency and accident. And they made sure he was stable, and they said, Vanessa, your child has to be in HDU. He is that critical. And within a matter of a few hours, they made sure he was stable, and he got a bed in HDU. And I, sir, CEO, I commend you for your sterling leadership and your bevy of dedicated and committed doctors and nurses. Because the moment I stepped in there, even your security officers, because I worked in the ambulance, the security officers there, they told me exactly where to go, have a seat, the doctors will be with you. And I was patient. They even came and asked me, do you want a glass of water or anything? First time I'm seeing something like this happening. My son was at the HDU for 4 days. And then the doctors came and said, your son is stable enough and it's time for him to move across and we're going to look for a bed for him. And he was given a bed in the teaching hospital, Ward 12 male. They called me, I told them, could you call me immediately when you get to bed? And they called me, I think about 9 o'clock that Sunday night to tell me, ma'am, we're getting your child ready to move up. I said, can I come? Yes, of course. They left my name at the security downstairs. I didn't have to go through no sort of waiting to get access to my son upstairs. The doctors, the nurses were all there to make sure he was comfortable, and he was in that teaching hospital, Ward 12, for a period of about 16 days. And they couldn't identify what it was, so he was given a bevy of tests as well. They all came back negative. The only thing that came up is that it was a viral infection this child had. But everything was fantastic. And also, I must give kudos to your auxiliary staff, because I saw those ladies cleaning. And so, ladies, doctors, I as the mother, I was there from as early as 6 o'clock in the morning, and I stayed right through until 8 p.m., ensuring that my child, I felt, was comfortable. And your doctors and nurses allowed me, said, ma'am, I'm sorry, it's basically an adult ward, so you can't stay in the ward itself, but you're free to go downstairs. If we need you, we'll come. We will call you or something. It was phenomenal. My child is doing exceptionally well. And so because of this, I wish to publicly thank Dr. Tilak Singh, Dr. Gosain, Dr. Ramroop, and Dr. Hussain, because they were with my child every single time. And he was given his drips, his antibacterial, his antibiotics with the IV. So you can imagine my son with this access and forever popping out every so often. And the minute it came out, the doctors were called and they were able to attend to him. And because of this, ladies and gentlemen, my son, he's a lower 6 student at Naparima College. And he says, Mom, I'm an avid scuba diver. I love the environment. I want to go into marine science. And because of the experience we've had at the San Fernando Teaching Hospital and the San Fernando General Hospital, he now says, Mom, on my agenda, I'm looking at a career in medicine to specialize in internal medicine. So I thank you, doctors, nurses, the entire staff. Sir, you are CEO. You are doing a fantastic job. Keep it up, and my blessings to you and the entire staff. Thank you.
Thank you, Ms. Vanessa, for sharing your experience. Next question, please.
Hi, good night. My name is Kevin Fellman, and I've actually been to some of these public board meetings before, so sorry to say some of these things are a bit repetitive. So we've heard about some of the changes that have taken place at the hospital, but I've been there several times between last year and this year, and you still see some of the same issues, such as dirty premises, faulty equipment, the roof falling apart. In fact, last year, I had to be warded, and after spending almost the whole day there, they gave me a recliner to sit on, and it was falling apart. So I spent most of the night walking along through the corridors, and because I couldn't sleep. And besides that, there are some live-in patients there who they just make noise all night. And I mean, I understand that people are in pain, but what is being done about those type of things? There are actually leaks coming through the ceiling. There are pigeons and cats walking in the ward and things when you're there as well, right? Now, we talk about the improvements that have to be made, but what I want to know is that the CEO talked about over $1 billion of expenditure, and you said that there are improvements to be made, but I mean, suppliers keep coming and, complaining that the Southwest Regional Health Authority is owing them, and the authority is in a lot of debt.
Thank you, Mr. Kevin. Could you push forward to your question, please? Sorry.
Yeah. So what I wanted to know is, what was the allocation for 2018, and was it debt, and how you all plan to really get the finances to execute these changes? Secondly, just on a note of corporate governance, last year I realized that the CEO sat as a member of the board, and this year I see that he's the CEO tonight. So just for clarity, I just wanted to know when did he resign from the board, and when was he hired to take up that position?
Thank you.
You mentioned about pigeon infestation at the hospital. When we came into office, we decided to investigate the best options for pigeon eradication. And we would have put in place earlier this year a pigeon detector system around our NICU. We tested it for close to about a month, and we recognized that it was solving the problem, and we're now going to expand that to our facility. So pigeon infestation in the Southwest Regional Health Authority. When we say pigeon infestation, we're talking, these are up in the roof, not really on the walls or so, as some people may feel. And so that may be a thing in the past, comes soon. The other aspect of funding, I don't have that figure at the top of my head, but you can speak to our corporate communications person, and we'll have that discussion with you outside of the forum.
Next question, please.
Good evening, everyone. My name is SWRHA, and I'm from Princestown. I'm a student at Costat. And my question is, with respect to the increase in refugees, how is SWRHA addressing the issues with regards to infectious disease, and what measures are in place for the management and control of meningitis?
Dr. Prasad, would you?
First of all, let me make the point that there are very few cases of proven meningitis. We have just only been able to prove that there are 2 persons who have had meningitis, so it's not an epidemic or anything. But we are very guarded about the whole thing. The fact is that there are certain types of meningitis that are spread due to a virus that are spread very easily and of course can contaminate schools and so on. We have gone into the schools first of all and lectured. 2, in the schools that we have suspected that the children with symptoms or features similar to what meningitis is, we have sent in our professional staff to screen. So for the moment, and I don't think for the last 2 or 3 weeks, we have even had any alerts with that regard. So at the moment, we can say that there are no cases or any suspected cases in the Southwest Regional Health Authority. When we do feel that it is very close to that, then we put them on what you call prophylactic treatment. That will prevent. I want to make the point that meningitis is caused by many different types of organisms. So sometimes it's very difficult to guess what might be causing it. But let me reassure the public at this point in time that there are 0 cases of meningitis in the Southwest Regional.
Next question, please. What's your name, sir?
My name is Alden Bedo.
Mr. Bedo.
Yeah, I live at Coquier, right? I'm just an ordinary rum shop plebeian. First of all, I like how you change up the format a little bit. You know, this 2-hour-long administrative report, very good. And I won't talk about the lack of parking again. I see the reporter had the CEO on the spot some time ago, and he had to take it up. Somebody had asked me to raise this point, and that is, and I didn't hear it in your so-called strategic plan, which is a list of things, aspirations. I didn't hear anything about dental services there. And I say this because just to tell you what I know from this person's experience. She's coming here in endless pain. She had something on the molar there. She has, she's on some public assistance. She's an outpatient here. And she has been touted along. They can't do it here. They have no dental services here.
Okay, Mr. Bedo, so your question relates to dental services?
So, well, that's not let the answer.
Okay.
You know, the one relieving thing about this meeting, which is nearly the same thing every time, is that there is somebody who makes a most heart-rending plea about something. And we heard it this afternoon. Last week we heard it. That is the one redeeming thing about this meeting. We've got to make this meeting a lot better. So I'm saying that this is what happened to this person. You don't know what I'm going to tell you. And she has been sent up to Mount Hope, come back down, nothing doing, sent her to say some of the health clinic someplace. I think she went to SWRHA, someplace else. Back to Mount Hope, back and forth, without money. She has an endless amount of Panadine and so on, and borrowing money. I'm saying this is what happens. So I didn't hear any mention about the dental services. Yes. So I would like to hear. I would like to hear about the ambulance services too, but I will leave it like that.
Thank you, Mr. Bedo. Dr. Prasad?
Comment on the dental services. Since the establishment of the regional health authorities, the dental services have remained with the Ministry of Health, and we've had very little control over that. But the good news is that within a very short space of time, the dental services are being handed over to the regional health authority. So we are in the stage of preparation of dealing with the dental services, and I hope that by the time we arrive here next year, the services will be a lot more viable and have been expanded. But I do apologize that our dental services really have been in a state of limbo for a while.
Oh, Dr. Prasad, if you could just...
Before you go, just to add something, please. A lot of persons are pointing out issues and concerns. What we ask is that we have set up systems for persons who have issues that can call into us at our customer solutions desk. Numbers are plastered throughout the hospital. It's on our website. Please, if you have a concern, call us. We have been operating with a 24 hours response time. So please, if you have a concern, call our customer solutions desk and we will treat with your concern. Thank you.
And just to reiterate, the number is 225-3962, and someone would be there to answer your call 24 hours. Next question, please.
Good night. My name is Cindy Raghubar Singh. I work with TV6. I just wanted clarification. No one answered the concern about immigrants coming into the country and if that has been posing a problem in terms of new diseases, that kind of thing. So I want to know if, that is a concern with Southwest. A lot of the illegal entries come in at this region. So somebody, posed that question. So I just wanted that addressed. Dr. Prasad, when you said that Southwest doesn't have any confirmed cases of meningitis, before that you said there were 2 confirmed cases. If you could enlighten us as to exactly where those 2 confirmed cases are. And I just see you. A colleague of mine asked a question earlier. I didn't see you address it. In terms of when you were a board member, when would you have stepped down, and then when you were hired as the, we just want to find out in terms of the proper protocol if that was followed in that instance.
Thank you.
So those 3 questions, please.
Thank you, Cindy. So the first question speaks to...
Hi, good evening. I'm Dr. Pedro Manala, Medical Director of Primary Healthcare. So regards to the meningitis cases, there were 2 cases that were highly publicized, both unfortunately stopped, 2 meningitis. One? Yeah. There were a lot of rumors since then about recurrent cases that has not been true. There are no more suspected cases, but we continue surveillance. What's the second question? Sorry. Migrants, right. So we have begun integrating the migrants into our into our healthcare clinics at the health centers Of course, they're primarily in Cedros and the southern region, but we've not had any concerns thus far with regards to communicable diseases, but it is something that we always want to look out for, and we continue to test constantly. Yeah. Okay.
In respect of the other question, I just needed to say that our present CEO, after he was a board member for just about 2 months and resigned. Subsequent to that, we had Dr. Albert Prasad acting as CEO for 3 months, and during that period, we advertised publicly in all the newspapers and interviewed and selected the incumbent CEO.
Hi, good day. My name is Vishal Ranjit Singh from Couva. I just wanted to find out when would the oral surgery department be opened at San Fernando Hospital?
Thank you.
Very good question. Oral surgeons are a very rare breed in Trinidad and Tobago. Very difficult to find qualified nationals who are oral surgeons. But again, the good news is we've had an application from an oral surgeon who is residing in the United Kingdom at the moment and has been planning to come home permanently, and we have been in contact with him and have undertaken that when he arrives in Trinidad, we will be most pleased to interview him with a view to employment. We've already looked at his curriculum vitae, and from that point of view, he satisfies all the requirements for employment. So within the next couple of months, our hospital should have an oral. Okay. Is it at the present time, there is a Cuban national whom we just about a week or two ago joined us at the San Fernando Hospital. So we are setting in motion a plan to have him deal with the oral surgery until such time that a national also joins the team. So within a very short space of time, we should be handling our oral surgery.
Madam Moderator, on a vote of thanks, if you would allow me.
Unfortunately,
just 1 minute. 1 minute. On a vote of thanks.
Unfortunately, from the end of our proceedings.
1 minute.
I would allow you 30 seconds.
Right, that's enough.
Okay.
On a vote of thanks, I would like to thank all and sundry because this meeting has been conducted in an atmosphere of cordiality. Thank you.
I would now like to invite members of the audience, if you have any of your comment cards filled out, we would like to collect those at this time. And if not, I would like to invite the Deputy Chair, Ms. Giselle McFarlane, to give the vote of thanks.
Good night, everyone. Ms. Betty Ann Pilgrim, National Administrator, Nurses Services, Ministry of Health. Mrs. Joan Yulee Williams, former Minister, Community Development. Members of the Board of Directors of the Southwest Regional Health Authority. Mr. Steve Delas, Chairman of the North Central Regional Health Authority. Mr. Keith McDonald, Chief Executive Officer of SWRHA. Ms. Satraji Maharaj, CEO of the Couva Regional Corporation. Alderman Hyacinth Rampasad Singh of the Penal Debe Regional Corporation, Mr. Edie Stewart, President of the Trinidad and Tobago Registered Nurses Association. You were quite quiet tonight. Ms. Ann Smith, President, Alzheimer's Association of Trinidad and Tobago. Ms. Sherry Ann Jones, Coordinator, National Alcohol and Drug Abuse Prevention Program. Mr. Kennedy Fleming, President of the San Fernando South Rotary Club. Mr. Nazim Hassan Ali, Presiding Officer, La Romaine Diabetic Support Group. Mr. Garnet Jessup, our External Audit Tender Committee member, management and staff of the Southwest Regional Health Authority, other partners in health, distinguished ladies and gentlemen, members of the media. Good afternoon. On behalf of SWRHA Board of Directors and as Deputy Chairman, it is a great privilege and joy for me to extend this vote of thanks to all those who have contributed to making this meeting a success. Firstly, we would like to express our gratitude to Nurse Carolyn Ramkelawan Budram for her melodious rendition of the national anthem, and Nurse Valerie Williams, our Acting Patient Care Coordinator, for her compelling and inspirational prayer at the start of this evening's proceedings. Chairman of SWRHA, Mrs. Valerie Alling Rawlings, we extend to you our sincere thanks for sharing with us the board's achievements over the past year and strategic goals and priorities of the RHA for 2019. As we work towards achieving the vision of becoming the center of excellence for delivery of compassionate quality healthcare in the country. To our CEO, Mr. Keith McDonald, and our Director of Health, Ms. Dr. Albert Passad, we are grateful for your comprehensive and informative presentation, providing the population with more details on the performance of this RHA. Thank you for your hard work and continued commitment to the SWRHA. We would also like to extend our appreciation to our Master of Ceremonies and Moderator, Ms. Alicia Riley, who expertly ensured a smooth flow to this evening's meeting and facilitated our question and answer segment. I would also like to thank all our distinguished guests and members of the public who accepted our invitation and took the time to attend our public board meeting. Your input is immensely valuable to us. Microsoft founder Bill Gates once said, "We all need people who will give us feedback. That's how we improve." Indeed, we are grateful for you sharing your concerns and inquiries about our progress as an organization. We welcome and are grateful for every contribution offered here this afternoon, for we believe that it is integral to enhancing our delivery of healthcare services and improving the Southwest RHA. We recognize that coordinating a public board meeting is not a simple task. Therefore, we must express our heartfelt appreciation to the board's secretariat, CorpCom, Policy Planning and Research, Quality, and the Security Services Department, along with other members of staff from various departments for their role in successfully organizing and executing this event. We also wish to express thanks to the members of the media for your presence and positive coverage of this event. To the administration of the San Fernando City Corporation, we would like to acknowledge our sincere gratitude for allowing the SWRHA to use the auditorium once again for this year's public board meeting. In closing, I would like to say thank you to the hard-working staff at SWRHA. Your commitment to dedicated service have led to our successes and accomplishments as an organization. We recognize that there is work to be done, and be assured the Board of Directors is committed to providing the necessary support to you as we continue to work together to provide the highest standard of health care. which ensures that every client accessing services at any of our health facilities in the Southwest region receives compassionate, quality health care. I wish you all God's protection and a safe journey home. Thank you and God bless.
Thank you, Deputy Chair. Ladies and gentlemen, before you leave, I remind you to submit your comment cards, please. The Board of Directors value your feedback, and I invite you to some refreshments on your way out, and thank you for your time.